Do you know that in Malaysia there are 7,967 people were reported to have received dialysis therapy in 2015? With 39,711 patients on dialysis by the end of 2016. Patients with end-stage renal disease are expected to number 51,000 in 2020 and 106,000 in 2040, owing to a rise in number of patients. Stop! Let me introduce myself. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and hello. My name is Mohamad Naqiuddin bin Mohamad Zaini from Bachelor of Information Systems Honours in Intelligent System Engineering based in UiTM Shah Alam with student ID of 2020957767 under the supervisions of Dr. Azlin Ahmad with my final year project Data Profiling Model on Dialysis Patient Data. Now, let's begin my proposal presentations. Let's begin. These are basically the 9 components that we will go through in this project. First, we will begin with research background. Next, we will go through the problem statement. Furthermore, research question and research objective will also explain in this proposal presentations. Moreover, scope and significance will also be studied, being explained in these proposals. Next, we'll go to the literature review, the research methodology. Last but not least, the Gantt charts. Let's begin with the first one, research background. Background of the study. First, we need to understand the chronic kidney disease (CKD). CKD is a disease occurs when one kidney fails to operate. One, which means individual kidneys fails to operate. The final stage of chronic kidney is end-stage renal disease (ESRD). Common kidneys that are not capable to function normally will need dialysis treatment to survive. Next, what is dialysis? What is dialysis treatment? Dialysis treatment is basically a treatment that we want to counter the chronic kidney disease. It's not a cure. It is just to help the kidney to process like normally. There are 2 types of dialysis treatment. First is hemodialysis. Second is peritoneal dialysis. These 2 types were used to purify the blood for dialysis patients. Profiling in hemodialysis. There are 2 profiling that are already being done to help patients from having severe adverse effect, which is sodium profiling and ultrafiltration profiling. We will go through to both of the profiling in the literature review section. Next, in the problem statements. In these problem statements, there are three indicators that we can combine it together to make one problem, which is the adverse effect. The first one is the adverse effect. Intradialytic hypertension is the most common and severe hemodialysis complications, and it has been associated with poor long-term outcomes. Patients may experience significant acute complications such as cramps, nausea, exhaustion, shortness of breath, and restlessness if they experience a recurrent intradialytic hypertension during the treatment, as well as substantial mortality risk in the medium term by Mayo Clinic. And according to patient profiling, patients on dialysis for kidney impairment have their medical profile, which includes sodium profiling and ultrafiltration profiling as mentioned earlier. Nevertheless, these 2 profiling are normally examined and viewed individually. So there's currently no what we call it combinations of profiling that can help patients and that can help to assess patients. Last but not least is the patient assessment. Patient assessment that is inaccurate may result in harmful treatment for the patients. Inaccurate pressure measurements, for example, might result in hypotension that may affecting the entire dialysis treatment. So the problem here starts when we don't have profiling model that can we don't have a combination of profiling model that can help these dialysis patients from having severe side effects. And these side effects has been a torture to the dialysis patients. Next, these are the 3 research questions that will be considered in this project. Firstly, what is the best method to gain high quality of data that can be used for modeling? Furthermore, what is the best machine learning prediction model for blood pressure? Last but not least is how is the performance of the proposed prediction model. These are the research objectives. First, to perform data profiling for dialysis patient data. Second, to construct machine learning models based on data profiling. Last but not least, to evaluate the machine learning model for predicting the adverse effects in hemodialysis patients. These are the scopes. Dataset is gained from hemodialysis patients that are currently active, receiving treatment in Avicenna Dialysis Center, City Alam branch. The data collected will be profiled to improve quality. Then the data will be used in prediction model. Last but not least, the data also will be visualized using Power BI tools after it is cleaned to see the relationships and the quality of the data. The significance of this project. First, the programming model will help nephrologists and nursing personnel manage and monitor patients during hemodialysis sessions more efficiently. Second, based on the demographic factors, patient profile may aid clinicians in anticipating presence and potential patient behavior. Last but not least, data profiling may help to lower the likelihood of post-dialysis adverse effects by allowing patients to receive safe treatment. Next, let's go to the literature review. In this literature review, there are 7 components that will be explained. First, the CKD. Next, the dialysis. Dialysis have 2 options, but our main focus is actually hemodialysis. Thus, the peritoneal dialysis will be explained just a little bit, just as our prior knowledge. Next, the data profiling, which will have 3 components of data profiling, 3 kinds of data profiling. Next, as mentioned earlier, the profiling in the hemodialysis, we will go further explains about sodium profiling and ultrafiltration profiling, the machine learning, and last but not least, the previous related work. Let's begin with CKD. Chronic kidney disease is actually the world's 16th largest cause of loss of life. And what is actually CKD? Chronic kidney disease, commonly known as chronic kidney failure, is a condition in which the kidneys gradually lose functions, fail to filter waste and surplus from blood that usually expelled as urine by kidneys. So according to Malaysia Ministry of Health, there's actually 5 stages of CKD. Stage 1, kidney impairment without decrease in glomerular filtration rate and normally without symptoms. Stage 2, decrease in GFR without symptoms but with elevated blood pressure and probable organ malfunctions. Stage 3, considerable decrease in GFR, rise in urea and creatinine levels in blood, organ failure. Stage 4 is the kidney function is severely diminished, blood levels of urea and creatinine are high, other organs are dysfunctional and symptoms are minimal. Stage 5 is actually the last stage and the most severe stage of CKD. Kidney function is no longer enough to sustain life, resulting in a variety of symptoms and organs abnormalities, known as end-stage renal disease (ESRD). Next, dialysis treatment. What is dialysis? Dialysis is basically a treatment for CKD patients to help them filter the waste and surplus from blood. There are 2 types of dialysis, which first is peritoneal dialysis, and the most famous one is hemodialysis. Peritoneal dialysis. According to National Kidney Foundation, for peritoneal dialysis cleans individual blood inside the body rather than outside of the body. The lining of individual own stomach serves as natural filter. For access, one will need a minor procedure to put a catheter in the abdomen. During the procedure, the peritoneal cavity is slowly filled with dialysate, which is dialysis fluid, via a catheter. The bloods remain in the peritoneal cavities, arteries, and veins. The extra fluids and waste products in the blood are drained and deposited in dialysate. So these are basically in the common way. In this below, a dialysate is entered the body, and the body will act. And during the procedure, the abdominal cavity is slowly filled with dialysates. In the abdomen, will slowly fill with dialysate filled via a catheter. And catheter is as a connections, and the waste will be drained out of the body. Next is hemodialysis. Hemodialysis is dialysis treatment that removes uremic solutes from the blood using artificial membrane contained in dialysis connected to the patient arteriovenous fistula. The necessity the use of machines. These required machines. Typically, most machines have 3 therapy sessions per week, each lasting 4 to 5 hours. How it works. During the hemodialysis, your blood is filtered outside of the patient body by a dialyzer. A dialysis nurse or technician insert 2 needles into the patient at the commencement of patient dialysis sessions. Each needle is connected to a dialysis machine via a soft tube. The dialysis machine circulates blood through a filter before returning it to your body. The dialysis machine monitors patient pressure and governs how speedily blood flows through the filter and how much fluid is eliminated from your body during the procedure. So as we can see in this GIF below, there are 2 soft tubes that were connected to the artery, to the veins, to the patient arm. So one will act as the output, which the blood will go out, and one will act as the input, which when the blood is already filtered, which we in the most common way is the clean blood, we will insert back to the body. But sadly, hemodialysis contains complications. These complications are anemia, cardiovascular disease, infection, immunity, renal osteodystrophy, and major problem is intradialytic complications. Patient may experience significant acute complications such as cramp, nausea, exhaustion, shortness of breath, and restlessness if they experience recurrent intradialytic hypotension, as mentioned in the introductions just now, as well as substantial mortality risk in the medium term. Intradialytic hypotension is actually one of the most frequent problems faced by hemodialysis patients. Next, data profiling. According to Monela Baviska in her YouTube video of 8 Introduction to Data Quality, reviewing source data, planning structure, content, interrelationship, and finding potential for data project are all a part of data profiling. Data profiling is the process of evaluating data from existing source and then integrating knowledge about it. Activities involved in data profiling include collecting descriptive statistics and data type, tagging with words, keywords, and description of categories, perform data quality assessments, discover metadata, and perform several table analysis. Articles written by Bowman from SAS Insight Editor state that there are 3 different kinds of data profiling. For instance, structure discovery, content discovery, and relationship discovery. Let's begin with structure discovery. The goal of structure discovery is to figure out how the data is structured. Simple basic statistics like minimum, maximum, mean, standard deviation will also studied in structure discovery. These fundamental statistics will aid in determining data veracity. The activity in structure discovery is column analysis. Next, we'll go to the content discovery. Content discovery is the process of driving down into database component in pieces to assure data quality in data profiling. This method aids in discovery of data that contains null values, erroneous data, noise, metadata management, and start with a count of all the data sets inconsistency and ambiguous. So this standardization procedure in content discovery is crucial by correcting the minor flaws because it might affect the data quality and machine learning model accuracy. So the activity in content discovery is commonly known as data cleaning. So last but not least is relationship discovery. So this stage comprises figuring out what data is being used and seeking to understand the relationship between various data types. This approach starts with a metadata analysis to discover critical interconnections, then narrow down connection between specific fields, particularly where data overlaps align. So there are 2 activities that we do in relationship discovery. First is the cross-column profiling, and next is the cross-table profiling. Next, profiling in hemodialysis. There are 2 profiling as mentioned earlier. First is sodium profiling, and secondly is ultrafiltration profiling. Let's go to the sodium profiling. Sodium profiling is a type of sodium gradient dialysis in which the sodium level is dialysate follows a time-dependent profile. These tend to limit the unavoidable fall in plasma osmolality caused by urea removal, reducing the fluid shift from the outside to the inside of cell. And then we lower the dialysate sodium concentration for a duration of dialysis session to avoid sodium accumulations. Ultrafiltration profiling, according to Zhao back in 2006, ultrafiltration profiling is used to focus on blood volume preservation. Blood volume is directly related to blood pressure, which we will use blood pressure as a target for prediction model. when the patient is overhydrated, the UF profile is usually designed to extract the majority of the total UF volume in first of the session to induce an increase in plasma onatic pressure and provide a greater driving pulse for vascular refilling. So these two profiling, as mentioned in the introduction, these two profiling were measured differently. Combining these two profiling lessen interrelated symptoms and minimize adverse effects. These are the previous related work that have been studied by the researcher. First, from Gomez-Pildo, the research team used the demographic and clinical background to predict appearance of hypotension using dosimetry and support vector machines. Minowachen and the team used linear regressions and deep neural network. Barberry and the researcher team used ANN, and Chiu used ANN as well to predict the body weight in hemodialysis patients. Research methodology. In this chapter, we will go through the flow chart, research questions, and the research framework. These are basically the flow chart for this project. We use the CRISP DM. First, we go to the business understanding, then data understanding. On data understanding, we will have structure discovery, which is the profiling techniques, as mentioned earlier, the first profiling techniques. Next, we go to data perfection, that contains two profiling techniques, which is content discovery and relationship discovery. Next, to the modeling, model development, evaluations, data visualization development, and last but not least, documentations. These are the research questions that associate with objective questions. These are basically the research framework. For the first objective, we will cover from the business understanding, data understanding, and data preparation. For the second objective, we will cover the part of modeling and evaluations. And for the third objective, we will cover data visualizations and documentations. These are basically the suggested Gantt charts that we'll use in this project. That's all from me. I will have a Q&A questions. If you have any questions, please do ask, and I'm flattered and happy to answer. Thank you.